We began this afternoon's discussion by hearing from Wendy about the different types of partnerships that are out there and different models and different expertise that each of the groups can bring in. And then we heard very specifically about the expertise that companies can bring to the table that includes training. We've heard Johnson & Johnson's experience in training, as well as from PATH we heard that they have a business planning model that we can learn from. And we also heard about the strengths that an organization like PATH can bring to the table, and that is having that knowledge and understanding of the population that you're working with and helping companies expand their markets. And then finally, we've also heard from MSH about bringing their expertise in working with local and vulnerable populations, and again, understanding that market, and also the specific expertise that each brought in capacity building and health service delivery. I think we've also heard of some great lessons learned. We've heard a lot of common lessons learned across, and I think that these are some takeaways and things for us to think about as we look towards implementing the various strategies and the Global Health Initiative and things that are out there. We have half hour to 45 minutes for questions. We do officially go up until 3 o'clock, so we can continue the conversation as long as you'd like to. But I'd like to turn to the audience for question and answer now to hear your thoughts.
Here was Hugh. You talked about having sustainable solutions for health, so trying to get to a point where you don't always need donors. Is that really feasible? I mean, the Global Health Initiative is putting $63 billion into developing countries over 6 years, but at the end of 6 years, what do they do? So when you're talking about sustainable solutions, I guess the bigger question is just, can global health ever break even or like be run as more of a business?
Right. That's a great question. I don't know whether we can ever get to complete break-even, because there will always be populations that are that will require additional assistance beyond what they can generate themselves. But I think what we're seeing is an increase in the number of in the populations that can afford some of these interventions, and a willingness, if you can show the value of those interventions, that they will pay for those. You know, in one example, we are in a partnership with the WHO on a meningitis vaccine. We worked very hard and, in fact, ultimately transferred a technology to a company in India in order to help create a price point for that vaccine of under 50 cents a dose. We looked, part of that analysis entailed looking at what current African governments spend for their meningitis outbreaks that happen every year, and the ability to use that expenditure that they already have for use with this new vaccine. And so in effect, it's creating a solution that already has a set of revenues associated with it. It's that the governments were already spending for that control in order to enable a better solution and a much longer lasting solution. So I think the short answer to your question is I don't think we'll ever actually get to the point where it's completely sustainable, but I think we can increase the level of sustainability that we currently achieve.
Pushing a little bit off of that on touching upon the incentive that could be offered by NGOs, but also on the macro level with USAID. Is there any sort of mechanisms we discussed, like point systems that maybe, let's say, corporations can be offered within a partnership? I think there was one that related to the energy crisis and giving them incentives for corporations to save money energy-wise. But on USAID saying, let's say, specifically to global health, having mechanisms where if they partner with MSH and PATH, that they can offer a point system that reduces their tax if they're under the umbrella of the U.S. government. Just general curiosity if you're any discussion on that.
I think that's an intriguing idea. I haven't heard that before, but I will say that one of the things that we are doing is looking broadly at a range of different kinds of incentive mechanisms, and easy area to talk about it is the product development side, where you have industry that actually has real capabilities to bring to the table, and it's very hard to bring these products into the marketplace without industry, yet there may not be a viable market opportunity out there for them to engage, and for that reason they've stayed away. And so thinking about the kinds of incentives we can put in place that actually would make it in industry's business interest to be able to bring products into the marketplace and to actually bring them into developing countries. And that Hugh talked about how in some cases the just changing market dynamics, where you have emerging markets that are becoming kind of the new frontier for industry, that's very helpful. But in some cases we really need to step in and build the right kinds of incentives for engagement. In terms of sort of other types of partnerships, maybe it's not product development, but where industry has some real expertise to bring to the table. I think we need to continue to think of ways to attract more private sector partners into the space, and if maybe someone wants to develop an interesting incentive idea, we're all ears, but certainly an important area to think about.
So So there are actually a couple of specific examples where there are attempts to craft incentives for industry. One is called the Priority Review Voucher, which is a voucher that is issued by the FDA for companies who create drugs or medicines that are specific to neglected tropical diseases. In that case, and there's been one priority review voucher that has been issued so far to Novartis for their development of a pediatric drug for malaria. But in that case, that voucher is awarded to the company, and the company can use that for any drug in their pipeline, and it's also transferable. They can sell it to another company. And the philosophy behind that is, for many companies, accelerating the regulatory process translates into millions and millions of dollars for them. And so if you can incent them to undertake activities for global health, for developing drugs against neglected tropical diseases, they can be rewarded by the acceleration of the regulatory process for drugs that have nothing to do with global health but are within their portfolio. And then a second example of an incentive is, and it's really still in sort of the testing phase, is something called advanced market commitments, where a set of donors have agreed to basically provide, it's a sales guarantee, that there is a certain volume of, in this case it's vaccines for pneumococcal disease, that will be purchased. That helps mitigate risk for many of the private sector partners, because as we discussed, sometimes the biggest risk is that they don't understand what the market is. Well, this gives a very specific definition to what the market opportunity is, what the price point is that they would need to hit in order to get access to those funds. And the current advanced market commitment for pneumococcal vaccines, I think, has 4 private sector partners who have who are sort of in the competition to try and win that.
Can I just add to the PRV comment? And these are 2 really great incentives, and we need to continue to build up our toolbox of incentives to attract different players to the table. But a new idea that's out there, and I don't know if anyone has seen this yet, but PTO has just issued a notice for comment on a very similar type of mechanism to priority review voucher. And it would actually be based on patents, and it's worth taking a look at. They want some comments and some feedback, and it's another way where there could be value. It actually would have, unlike priority review vouchers, which is really limited to drugs and vaccines and kind of a smaller subset of products, this new PTO mechanism, if it went forward, would actually have much broader applicability for any company that has a patented technology that has a global health application. And so it could be quite broad. In fact, it might be very broad and bring in a lot of different vouchers. So it has the potential to create many new vouchers that can be traded in the marketplace. So new idea that's out there and worth taking a look at.
So I'm not sure if your question was specific to U.S. government incentives, but certainly in terms of global health, there are many incentives out there, including things like, so for microcredit organizations that are adding health education, health insurance, health services. So there are organizations, for instance, like ProMujer, who offer health services, organizations like Freedom from Hunger that work with microcredit organizations to do health education. There are financial incentives such as they receive a higher rating for loan guarantees. So if you are a small microcredit organization, you suddenly begin to do health services or health education, and you become eligible for larger and larger loan guarantees, meaning you can add additional clients, meaning you can make more profit, et cetera, et cetera, et cetera. So there are some maybe non-traditional incentives that are not necessarily government supported, but are offered by other industries like the financial industry.
Great, thank you. There's also a bill that Congressman Payne introduced earlier this year giving tax incentives to private sector for research and development for neglected tropical diseases. So there has been some various experiments out there